back I go. Thank you to all of our speakers thus far, and Deputy Commissioner, I applaud you for your efforts for the integrated licensure initiative. Whatever we can do to support that, you can count on Hackensack Meridian. Thank you so much for that. So now it's a distinct honor of mine to introduce former Congressman Patrick Kennedy. Patrick is the founder of the Kennedy Forum. It's a national organization that's dedicated to leading a national dialogue on transforming mental health and addiction care. The organization brings together mental health advocates, business leaders, and government agencies to improve outcomes and reduce stigma. And you just heard from the Deputy Commissioner how important that public-private partnership is. As co-founder of One Mind, Patrick helped spark a global revolution of how scientists collaborate to study, diagnose, and treat brain disease. Patrick was also appointed to serve on the President's Commission on Combating Drug Addiction and the Opioid Crisis. He is a best-selling author. Patrick also served the citizens of Rhode Island's 1st Congressional District for 16 years with distinction. He fought to end discrimination against mental illness and addiction and is best known as the lead sponsor of the groundbreaking Mental Health Parity and Addiction Equality Act. And I can tell you, Patrick Kennedy came to Jersey Shore University Medical Center, I think it was, when was it, Ken, about 2 years ago? Less than 2 years ago. And he gave a compelling talk to the community, to our caregivers, to our board members, and that talk really inspired Hackensack Meridian to really become a leader in behavioral health and to do something different. It was after Patrick Kennedy's appearance at Jersey Shore that we started to seek a partner in behavioral health, which led to our historic partnership with the Carrier Clinic. So we thank you for being an inspiration to us. We thank you for everything that you've done to really change the lives, literally, of thousands of people who have mental illness and addiction treatment. Ladies and gentlemen, Mr. Patrick Kennedy.
Thank you very much, Bob, and thank you, Don, and thank you to all those government officials and members of the board and people who are working in this clinic and family members. Thank you all for being here. This is an exciting time in this country when you consider the changes that are happening in our medical system, and one sign of that is right behind me. So I had the distinction in Congress of being an author of a piece of legislation that said that the brain was part of the body. And you know, it took us in Congress years to come to an agreement on that resolution. But we finally did. And this legislation says that no longer in this country should we treat those with brain illnesses any differently than we treat illnesses of any other organ of the body. Whether you're inpatient in-network or outpatient in-network or inpatient out-of-network or outpatient out-of-network, or you need pharmacy or emergency room benefits, all of them must be on par, hence the word parity, with what you would do if you're treating the chronic illness of diabetes, cardiovascular disease, cancer, HIV, any infectious disease. We expect no less of the same sense of urgency and dedication and respect when treating these illnesses and the people that suffer from them, as we would expect for those who are treated from any other illness that may bring them into the medical system. And I will say, as we all can acknowledge today, it's never historically been the case in this country where we have treated people with these illnesses in the same fashion that we have any other set of illnesses. Alcoholism has been around from the beginning of time. It's shocking given the prevalence of addiction, the prevalence of depression and anxiety, that we've never as a nation said that when someone comes into a medical facility, we need medical providers to be educated on how to treat their illnesses. Because, my friends, you cannot treat any other physical illness without also treating someone's mental illness and predisposition for addiction as well. Especially at a time now where the public health crisis of suicide and overdose is at an all-time high. And yet, our nation's response to this crisis is pitiful. Congress can today do jumping jacks thinking they've increased the money for the opioid crisis. And I will tell you, as a member of President Trump's commission, we're doing nothing to address this crisis. We're finally appropriating from $500 million just 4 years ago. Imagine that. For this nation, we were losing 60,000 people, $500 million. Till today, we're spending $6 billion. That sounds like a lot of money. But I'll tell you, when you compare it to HIV/AIDS, we were losing 53,000 Americans. We spent $24 billion a year to combat HIV/AIDS. So 1/5 the money of HIV/AIDS. That's what the lives are of people who are dying of suicide and addiction. Their lives are worth 1/5 of what we were spending on HIV/AIDS. And I guarantee you, a fraction of it as much as what we do to protect people from cancer or heart disease. Frankly speaking, we do not pay attention. We treat people in a discriminatory way. We say we want them to have separate and unequal treatment. That means we don't pay for it the same way. We don't treat it as the chronic illness that it is. But what I love about what Bob and Don and all of you have done here is you're setting an example of what the future should look like. If we get our act together, we want chronic disease management of these illnesses. We want them integrated into the rest of physical health care. And all of that is represented right behind me with this new urgent care center. When you have an urgent care crisis for mental health, you go to an ER and you can wait too many hours, and when you finally get seen, you can still languish in that ER for days. When what you would get here is immediate treatment. You get the attention that you need. And by the way, you get the coverage you need for all of your other physical ailments. Because keep in mind, no one comes in here with just a mental health concern, or just a contusion, or a concussion. You can't treat any other physical illness without also treating these illnesses, and vice versa. That's why they have to go together. And what I love about what you have done at Meridian Health is that you are going to draw the whole continuum of care out and say, as a healthcare provider here in this state, you're going to cover people from severe care when they need that really emergent care to community health care. Because at the end of the day, we want community health care. Yes, we want access to emergency services, but there's no need for emergency services if you do community health care right and early in a preventive way. President Kennedy said that people with these illnesses, quote, need no longer be alien to our affections or beyond the help of our communities. He didn't say beyond the help of our psychiatric hospitals, but we need psychiatric hospitals. We need more beds for psychiatric hospitals, but he didn't say that. He said communities because he knew that it takes all of us working together in order to make a difference in helping people get the care in the community, away from the asylums of the past. But you know what the new asylums are? The jails in Neptune, the jails here, the jails all across this state. They're the new asylums, as well as people getting languishing care in the ERs and them living on the streets. Those are the new asylums. And we have to have a commitment to doing something much better in keeping with this great nation and what it can be. So I thank you all for doing what you've done. I want to say how much it means to me, especially to be here with Phil Perricone, who lost his son a few years ago and has decided, instead of running away from the stigma of his son's passing, instead he wants to change the whole attitudes towards people with these illnesses so that other parents, like he and his wife Marilyn, do not have to lose a child anymore, because we don't do everything that we already know how to do to prevent tragedies like have befallen his family and frankly have befallen every family in this country.